Hi there. I need your help assisting patients with mouth, teeth, and denture care. Proper oral care helps promote patient comfort, oral health, and nutritional intake. Without effective oral care, a patient can develop dental caries, also known as cavities. Hospital. Hi there. I need your help assisting patients with mouth, teeth, and denture care. Proper oral care helps promote patient comfort, oral health, and nutritional intake. Without effective oral care, a patient can develop dental caries, also known as cavities, hospital-acquired pneumonia, or other infections. Patients may also experience reduced nutritional intake, which can increase mortality and the length of their hospital stay. This patient's name is Zoe. I've confirmed her identity using two identifiers. Zoe is unconscious, so we've introduced ourselves and explained the procedure to her family, who gave consent for us to perform oral care. I've also pulled the curtain to ensure privacy. Before we begin, we need to perform hand hygiene. To wash your hands, point at the hand hygiene button and press the trigger. Point at the hand hygiene button and press the trigger. We'll use the hand hygiene button throughout patient care as necessary, including when entering or leaving the patient's room. Always follow established safety, hygiene, and infection prevention policies and procedures. I've already confirmed Zoe has no contraindications for this procedure and made sure the wheels on the bed are locked. Raise the head of the bed to at least 30 degrees. Press this button. We'll adjust the height of the bed to use proper body mechanics and reduce risk of workplace injury. Touch the bed panel. Press the up button to raise the bed until the mattress is even with your hips. Press the confirm button when you're done. Press the confirm button when you're done. We'll don gloves for this procedure. Your supplies are on the bedside table. We'll inspect Zoe's mouth before brushing. Even though she's unconscious, we'll talk to her and explain what we're doing. Using your controller, point to and select the Talk to Patient button. Select the Talk to Patient. Select what you want to say to Zoe. Select what you want to. Select the Submit button. Hi Zoe, we're going to take a look at your mouth before we brush your teeth. We need to gently turn her head to the side. Zoe, we're going to turn your head now. Touch here. Zoe, we're going to look inside your mouth. I'll gently open her mouth by pressing on her chin to move her lower jaw. Use the grip button on your controller to pick up the tongue depressor. Use the grip button on your controller to pick up the tongue depressor. Gently push down on the distal aspect of Zoe's tongue with the tongue depressor. Be careful not to put the depressor too far into her mouth, as this can elicit the gag reflex. Let go. I'll hold it in place. Pick up the pen light. Point it into her mouth. Press the trigger on your controller to turn on the light. Examine the oral cavity. I do not see anything that looks concerning or needs to be reported to the provider. Press the trigger again to turn the light off. Press the trigger again to turn the light off. Put the pen light down. We're done with the tongue depressor and pen light. I'll take care of them. If you'd found anything abnormal, such as irritation, raised areas, sores, or damaged or decayed teeth, you'd need to stop, report your findings, and wait for instruction from Zoe's healthcare provider. Let's dispose of these gloves. We'll also perform hand hygiene. Select the hand hygiene button. Let's get Zoe situated. To prevent choking while we perform oral care on an unconscious patient, we need to roll Zoe on her side. Tell her what we're doing. Select what you want to say to Zoe. Select the Submit button. All right, Zoe, we're going to roll you on your side so we can brush your teeth. Touch her right shoulder and I'll help you move her. There you go. You'll need to cover Zoe's chest with a towel to catch any saliva that spills while we brush. Pick up the towel. Place it here, where I'm showing you. Place the towel where I'm showing you. We'll also don clean gloves. Pick up the emesis basin. Pick up the emesis basin. Place it below her chin. We'll use the oral airway to keep Zoe's teeth apart and stop her from biting during oral care. I've selected an adult-sized one for Zoe. Pick it up. Zoe, we're going to put an oral airway in your mouth to hold it open while we perform your oral care. Insert it and twist it to the left to rest between her teeth. Remember, we're not using the device to maintain her airway, just to keep her teeth apart. I'll turn on the suction to the tonsil tip catheter. Pick it up. Press and hold the trigger. Dip the tonsil tip catheter in the cup of water to lubricate it. Keep covering the hole with your thumb. Remove it from the cup. We'll use the tonsil tip catheter to suction any accumulated secretions in Zoe's mouth. Since she's on her left side, saliva has accumulated in the left side of her mouth. Insert the tonsil tip catheter into her mouth. Keep your thumb over the hole and hold the tonsil tip catheter in place to suction the accumulated saliva. You must keep covering the hole to use the suction. You must keep covering the hole to use the suction. Keep holding the... Nice work. Lift your thumb off the hole on the tonsil tip catheter. Put it down. We're almost ready to brush Zoe's teeth. Let's prepare her toothbrush. Pick it up. You'll need to moisten the bristles. Dip the toothbrush in the cup of room temperature water. Pick up the toothpaste with your free hand. Bring the toothpaste to the toothbrush. Press the trigger to squeeze out a pea-sized amount of toothpaste. Press the trigger on your other controller to squeeze out some toothpaste. Good. Put the toothpaste down. I'll put it away. You'll use this model to demonstrate brushing. Gently brush the teeth and gums using small circular motions. Remember, brushing should be performed twice per day and take at least 2 full minutes each time. Let's visualize the bacteria to observe what you cannot see with the naked eye. Now you'll brush the teeth. Keep in mind that this is a short demonstration. Actual toothbrushing should take about 2 full minutes. You'll start at the model's upper right teeth. They're on your left. I'll move the oral airway to Zoe's left side so we have access. Bring the toothbrush to the model's upper right teeth. Oh, that's a little small for these teeth. I'll fix that. Remember, use small circular motions. Brush the outer surface of the upper right teeth. Brush the inside of these teeth next. We'll work clockwise around the mouth, so we'll move to the left side of Zoe's mouth next. The oral airway is obstructing access, so I'll move it. Bring the toothbrush to the upper left teeth. Brush the outer surface of the upper left teeth. Now the inside. Move down to the lower left teeth. And the inside. Now we'll brush the lower right teeth. Brush the inside. Finally, brush the tongue. Great, nice and clean. Put the toothbrush down. Let's suction any buildup of saliva again. Use the tonsil tip catheter. Lubricate it first. Insert the tonsil tip catheter into her mouth. Hold it in place until you suction the saliva buildup. Keep holding the trigger to cover the hole. Hold the tonsil tip catheter in Zoe's mouth while you suction the good. I'll turn off the suction. Put the tonsil tip catheter down. Let's clean her mouth with mouthwash. We'll make a 50-50 solution of mouthwash and water. There's too much water in this cup, so I'll pour some out. Pick up the mouthwash. Pour about ½ an ounce into the cup of water. Put the bottle down. Oral rinses usually contain an antiseptic to kill bacteria in the mouth. This fights tooth decay and can reduce bad breath. Pick up the swab. Dip it in the mouthwash solution. To prevent aspiration, we'll need to squeeze out any excess liquid. Press the swab against the top of the cup to drain it. We'll start on the model's upper right side again. I'll move the oral airway. Bring the swab to the upper right gums. Bring the swab to the upper right gums. Clean the gums from back to front. Move clockwise around the mouth. Bring the swab to the roof of the mouth. Drop the swab in the regular waste container. Oops, I'll throw that away.